Today is very, very important for cancer research in Malaysia, and I know Kate has got a very special guest with her this morning.
I certainly do, Michael. The tournament began in 2010, and so did its Association and Support for Cancer Research Malaysia. And we are very lucky indeed to have our special guest with us today, Professor Teo Interview, Chief Executive Officer of Cancer Research Malaysia. Sue, it's a busy day, it's a wonderful tournament. It's unbelievable to think that over $600,000 US has been raised through this tournament, and to so many good programs as well.
Absolutely, Kate. It's once again a huge delight and an honor for Cancer Research Malaysia to be associated with the Sime Darby LPGA. You know, this is the biggest tournament that will raise awareness about breast cancer, and what a wonderful way of doing it, right? Declaring it a pink Saturday, having everyone in glowing pink and pretty in pink, and even the men are out here in pink in support of Cancer Research Malaysia, as well as what we're trying to do for breast cancer.
And there's lots of fundraising activities. How can we all get involved? How can we donate today?
Well, you're absolutely right. There are lots of fundraising activities. There's going to be a special pink lunch today where tickets have already been sold to raise money for cancer research. And in addition, we're selling these raffle tickets. So they are only 10 ringgit each. They can be bought here in the piano lounge at the Cancer Research Malaysia booth. And it's a fantastic prize up for grabs. It's a 2-night stay in a hotel, in Amanpuri Hotel in Phuket. And each night is worth nearly $6,000 US. Wow. So this is an amazing opportunity to get a fantastic holiday just by buying a raffle ticket. Who knows who will get this prize, right?
Well, there's lots of good initiatives like that. Now, Sue, of all the programs that you have funded, the patient navigation program is a particularly good one, and you're very proud of that.
Yes, I think one of the things we're very, very keen on is making sure that we can improve survivorship for cancer here in Malaysia. Cancer incidence is increasing, and unfortunately not all women have access to information. So for many women, when you tell them that they have cancer or breast cancer, they think it's a death sentence. What we really need to do is to help them through their treatment journey, ensure that they have access to the information that they need, ensure that they have access to the services that they need. And sometimes it's holding a hand of a survivor. Sometimes it's about paying a simple thing like a taxi fare, or paying for someone to take care of dependents like children or elderly parents, so that the disadvantaged women can actually go for treatment. And that's absolutely what we're doing through the patient navigation program. So in the past few years, we've been consistently navigating more than 200 women. I think about 450 women have already benefited from navigation services, and many of these women otherwise would have been lost when they've been diagnosed with breast cancer.
Okay. And how should we get checked? When should we get checked as women?
I think as women we get really confused, right? It's like, when should you have a breast self-examination? Well, that's from the age of 25. You should really know what your breasts normally feel like and have a check every month or so to kind of work out whether there are any changes, because the reality is we and our husbands or partners probably know our breasts better than anyone else. But in terms of screening, and this is for individuals who don't have any signs and symptoms, but we recommend screening so that we can pick up cancer early, then we recommend screening from the age of 50 with a mammogram. Of course, if you have any signs and symptoms, if you have a lump or you have a nipple secretion or anything else, that's no longer screening, that's diagnosis, and you should go for a diagnostic mammogram as soon as you can detect one of those signs and symptoms. So learn what your breasts normally feel like, learn what are the signs and symptoms and when you should go and see a doctor, and even if you have nothing, from the age of 50, go for screening every 2 years.
And it's wonderful that through your organisation, CRM, that more women are facing up to the bravery, because it is very nerve-wracking for a woman to go to the doctor and to ask for an examination. People are reluctant to do so. There is this fear attached to it.
You're absolutely right, Kate. And you know, for many women who detect a lump, oftentimes they go into denial. They'll say, well, maybe it's not. Maybe it'll go away. Maybe I will take this multivitamin, maybe I will take this herbal remedy, it will go away. But the reality is that we can't cure cancer in that way. We can cure cancer when it's presented at an early stage, which is why we really want to encourage all women come forward, recognize the signs and symptoms. Breast cancer is by far one of the most survivable cancers of all. So we should have a lot of people who can not just survive breast cancer, but thrive after breast cancer. This is where we want to get all women. You know, today there have been a couple of breast cancer supporters, survivors who've been here at the tournament, and they've been with us for the past 8 years, right? And they come here telling us, you know, when I was diagnosed, I thought it's a death sentence, but now I know I can survive the disease if it's diagnosed and treated at an early stage.
Okay. Well, we have all sadly been affected by breast cancer, directly, indirectly. And a lady who has worked on this tournament since its beginnings, Zelina Zaire. She very sadly passed away this year from breast cancer, and everybody here misses her dearly.
I know, unfortunately, this is a harsh reality. We are continuing to see patients, some patients die of breast cancer, even some with supposedly very good outcome disease dying of the disease, which is why I think it's fantastic that Sime Darby LPGA, IMG, so many of our partners are highlighting the need of conducting research, of supporting breast cancer patients, of speaking the pink up to raise awareness for cancer, and to be able to make sure that we put the message out there that we can do more and we will do more to be able to reverse cancer.
Well, you do a wonderful job. And we also want to send all of our love to Lily, Zelina's sister, and her family, because we do miss her very, very much indeed. So thank you for inspiring us and for the tremendous work that you do with Cancer Research Malaysia. Thank you.